Hello, and welcome to the November 9th meeting of the Sedgwick County Stimulus Review Team. Today, we're going to be looking at an application by Rock Regional Hospital, as well as an additional request from Ascension Via Christi. Before I toss things over to Brent, as usual, I'll be taking roll. Mark,
Here.
Dr. Walker,
Here.
Melody,
Here.
Jane,
Here.
Hope,
Here.
and Brent.
Here.
Fantastic. All right, and with that, I'll go ahead and toss it over to you, Brent.
Okay. Thank you, Aaron.
I'm here too.
Oh,
Aaron.
and Kyle, I'm sorry.
Wasn't that good of a joke? Trying to cut me out already.
Oh, boy. Thank you. Now, Brent, I'll toss it over to you.
Okay. Thank you, Aaron, and welcome everyone to this morning's meeting of the Financial Stimulus Review Team to look at CARES allocation, public health and social service agencies. I just want to send a shout out to the team that's joined today from Chairman Meitzner. Pretty much every county commission meeting talks about the valuable work that you are doing, how much you are appreciated. It does help the commission as they look to make final approval of the recommendations. So these CARES dollars. So it is important work, and we do appreciate it. I know that the commission does. So just wanted to pass along that because Chairman keeps mentioning it, says pass along the good words. So we're doing that this morning. As Aaron mentioned, we have two requests this morning to look at. One from Rock Regional Hospital. The second one is from Ascension. It's a supplemental request to the request that they approved last week by the commission, as well as this board. So, Hope, which order would you like to take them in? You want to take Rock Regional first, or?
Sure, let's start with Rock Regional. All right, so Rock Regional put in a request for $650,000. I sent some additional information out yesterday to the team. I hope you had a chance to look at it. What they're requesting for is three categories. One is payroll and personnel, which is composed in that spreadsheet. They're asking for some traveling nurses, and then a new full-time permanent position for infection preventionists, some temporary staffing, and a couple new nurses, and then also some overtime or additional hours that they're going to have to pay to their current staff. And they gave us a great breakdown, the method of how they determine the dollar amounts, and then how it is COVID related. And then, let's see. So they are asking for the $650,000. And for supplies and equipment, they took the actual or quoted amounts for any items that they had related to COVID. So Jane had asked me if I could kind of get back with Rock Regional and ask them how many beds they had and basically what their COVID numbers are. So let me get that information that I sent last night. Sorry, I thought I had it all pulled up here. So she said that as of today, they currently have 5 patients in-house with COVID, that they have 3 ICU and 6 med/surge beds that are used for COVID as needed. And they have a total of 31 beds at their hospital. 6 of those are ICU, and then 24 are the med or surgery beds. So with that, does anybody have any questions or comments?
I have a question for Lindsay. When Ascension asked for nursing, they asked for only the difference between regular pay and what it would cost for traveling nurses. So we talked about last week, we thought that was because they have to certify that they're not billing these costs to any government agency such as Medicare. So how would Rock be able to do this with what they've asked for? That appears to me to be a problem. Can't hear you.
Can you hear me now? Okay, apologies. Again, my phone is too smart for me. So I think it definitely would be a challenge. We would need to make sure that that was part of the contractor agreement, which it already is the base of the subrecipient agreement, that there can't be duplicative funding. So I don't know if that's something Hope could maybe reach out to Rock Regional real quick and just kind of get clarification on how they intend to resolve that. I think that's a good point and a good question.
Lindsay, when you say resolve that, is it the difference between, what was the question that you wanted me to ask specifically?
So essentially, I think Jane's question was last week when we were dealing with Ascension's personnel, they were having us cover that difference. They weren't having us cover the base cost, and the speculation was that because that would still allow them to bill for those base costs and it wouldn't have duplicative funding. If we are paying base costs with this, we just need to make sure that there's not going to be where they're also billing then CMS like Medicare or Medicaid, so they're not getting duplicative federal funding, well, really duplicative funding of any type.
Sure, I can reach out.
They can't get money and also bill.
Okay.
Is the county plan a health plan that they first go to the 2 regional hospitals, and this is part of there's some coordinated, this is where overflow patients go, or? There aren't very many beds there, is what concerns me.
This is Melissa. It's a small regional hospital, of which there are fewer and fewer in Kansas. This is a new one, thank goodness, for the area. So, and typically small regional hospitals have a small number of beds, just like this facility. So it looks like what it should for what it is.
Okay. Do the 3 hospitals then kind of coordinate it so that they know where that they have some space there?
That's a good question. I don't have an answer to.
Yeah, I don't know that I have an answer, but according to the information that they provided, they talked about EMS moving people from some of the larger hospitals to them. So I think there's some coordination. I couldn't speak to what that is.
Why do hospitals pay Sedgwick County EMS?
Why do they pay EMS?
I mean, that's one of their things, 16,000 that so it's like the county giving money to pay the county.
They're transporting patients to Rock Regional for hospital care.
So the hospital pays that? I thought it would be billed to the patient.
Depends on what kind of insurance the patient has. If the patient is using public insurance, then that would be billed. Employer-based private insurance or marketplace insurance, that would be billed. So that's another one of your federal questions. Who's paying the transportation cost of EMS? It is tied to the patient, you're absolutely right. But we don't know if the payer is public or private. Hope gets back pretty soon because we're just making this up.
Yeah, I sent an email and she was pretty quick yesterday when I sent her an email. So fingers crossed we'll get a quick response this morning as well.
It just doesn't seem that we should do one thing for Ascension and a different for this hospital.
That's kind of, so our discussions have tried to point applicants in the direction of things that they can ask for. We haven't seen EMS costs before on an application. I think they're a legitimate cost if they are COVID related, if the patient is being transported because they need hospitalization for COVID-19. I can't imagine that you could make a case for that other than that.
Yeah, and in her spreadsheet that we got from Rock Regional, they talked about their actual cost times 15% for their cleaning and times 20% to get down to the number that were specifically related to COVID. So I did have a conversation with their CFO last week as they were preparing to provide us with this request. And one of the things that they were focused on is that conversation was making Sedgwick County specific, COVID related, expense related, not loss of revenue. So
Yeah,
tried to give some guidance in that area.
I saw the 15% and the 20% on cleaning EMS. So that was my assumption too. Those are COVID related costs.
Hope, and I may have missed this, just kind of high level overview, because I think I had to skip out there last time. Can you kind of give me a refresher on where we're at, how much we have unallocated, and what Via Christi or Ascension's request is, and then Rock's is 650,000? I can't remember, and I apologize. I'm sure you've shared that with me.
No, I don't. Did Aaron or Brent? Did you guys talk about that? Okay.
I've got the spreadsheet up. After last week's county commission meeting, there was $4,225,000 remaining unallocated. The additional request today from Ascension is $2,869,000. Then this request from Rock Regional is $650,000. If those are fully funded, remaining balance is about $706,000.
Yeah, and as of this morning, we didn't have any new applications either. I double checked this morning, so.
Brent, would you give me that remaining balance again?
Currently, it's $4,225,000 and change.
Mm-hmm.
After this morning's meeting, if these two were fully funded, they come to a little over $3.5 million. It leaves us $706,000 and a little over $706,000.
Okay, thank you.
Mm-hmm.
Aaron, did you or Hope send us a spreadsheet that shows the original amount requested and the amount awarded to each of the applicants? It doesn't have to be up to date, but at some point, did you do that?
Yes, that probably went out 2 or 3 weeks ago. I can try and find that in the archives, if we want to call them that, and send it back out to you.
That'd be great. If you could send that now, that'd be fantastic. Thank you.
So do we think these positions have been filled, that those first top, like 9, what they say, new traveling nurse? Because if they haven't, they don't have 8 weeks either. 6 at the most that they would get in. And if they haven't hired them yet, that's going to even be hard. Do we know, Hope, if they've already hired these people, or?
I do not know that. Brent, do you happen to know from any of your conversations that you had with them?
I think, I don't know for sure. I think they may have hired some of that temp staffing that they indicate on there.
That looks
But-
like,
Yeah.
but not those top positions do not look like they have hired them yet.
I don't think they have hired them all. They, as I understood it, they were looking to hire them. They may have some folks identified. Don't know that, but they would want to add to the staff.
Because down at the bottom, the new ones they're talking about, they're saying starting December 1st. So that cuts the dollars way back if
Right.
they're only going to be 4 or 5 weeks.
I did get a response. So she said that for traveling nurses, we will basically pay them as purchase services / contract labor charges, depending on which firms we use to get the nurses. We have tried recruiting nurses recently, but they are getting over $100 per hour at other hospitals, and we do not currently have the funds to offer those rates, which is what we are hoping this grant will help with. Charges are based on the care the patient gets. IP pays on DRGs, patient diagnosis codes, and OP pays percentages of services given. However, the nurses' salaries are not reimbursed by insurances, so we would not get duplicate payment.
Well, how could that be? I mean,
So that was a complicated response. Do you mind reading it one more time?
Sure.
Sorry.
I thought maybe everyone else knew what it meant, but
She's referring to the International Classification of Disease Codes, ICD-10 now. And when you bill based on a diagnosis, and then you also bill based on the services that are provided. So a night in ICU or meals or supplies, medical supplies, et cetera, and staff, physicians, nurses. So diagnosis, charge.
did you want me to read that again, Dr. Walker?
I still do.
Sure, I will. Okay,
Thank
I'll
you.
try to talk a little slower too. Sometimes I talk fast. So for traveling nurses, we will basically pay them as purchased services / contract labor charges, depending on which firms we use to get the nurses. We have tried recruiting nurses recently, but they are getting over $100 per hour at other hospitals, and we do not currently have the funds to offer those rates, which is what we are hoping this grant will help with. Charges are based on the care the patient gets. IP pays on DRGs, and OP pays percentages of services given. However, the nurses' salaries are not reimbursed by insurance, so we would not get duplicate payment.
That is a basis of payment I've not seen before. Interesting. I think this is back to Lindsay. So when they submit these expenses, you're going to have to review them.
Without a doubt. And that is,
if they're dealing with
Dr. Walker.
It's okay. It's hard with Zoom. It could be that the firm that they're contracting with is getting reimbursed by a federal source of funding. So is being one step removed sufficient? Or do they have to document the source of payment?
They'll need to document the source of payment, and that'll be something that we can, if this is approved today, we can say as long as it's eligible, which of course the contract accommodates, and then we can work with Wood O'Brien's when those reimbursements actually come in to determine what's appropriate to pay and what's not, and maybe work, since Brent and Hope each have contacts, maybe they can work with the folks there just to make sure we're setting this up to be successful from the get-go.
But yeah, Lindsay, I'm concerned about that. This does not appear to be an entity that has much in the way of cash reserves. So if they go out and hire these people, they've got to have some assurance they're going to get paid, because they don't have the money to do it otherwise.
I think the only concern I would have at that, though, is if they're being reimbursed for it because they're billing, then we definitely don't want them to have that duplicative benefit. So it seems to me, one way or the other, they're going to get some kind of reimbursement to cover their actual costs. And that's really what we're intended to do here through this reimbursement type program, is to reimburse actual costs. And so I think with some planning, and perhaps you all make it conditional on that type of arrangement. And this may be something where there's a separate agreement similar to what was done for the African American Council of Elders, where maybe it's not the stock template that's used.
So hospitals receive prospective payments from the federal government, from CMS. That's what the diagnostic, the group, the DRG refers to. So they're talking about using that payment and then reimbursement on a cost basis for services. But we're unsure about where the reimbursement is coming from. Is it coming from private insurance or public insurance? So there's two pieces of payment here. One is the prospective payment that hospitals receive, including Via Christi, and the other is the payment based on the cost of delivering a service or a set of services. It didn't come up in the Ascension application because I assumed they backed the prospective payment out. But now I'm unsure.
And kind of speaking with my contact, I think maybe she was a little bit confused on what I was asking in terms of the base cost versus the additional cost for the traveling nurses. So kind of like Lindsay had talked about with us doing our back end work to make sure it's okay, I think maybe a phone call might be better if I could actually kind of talk through it with her. So again, I will make assurances that I fully get everything, all the information that you guys need. So if you guys did want to approve it today up to a certain amount based on certain contingencies, I can make sure, one, if it's the additional weeks like Jane had talked about earlier, if there's too many, because she did respond and say they have hired 3 traveling nurses in the past month, and they already hired the infection preventionist who started on 10/1. So if I need to get some updated information, I can, and we can also check on the base billing and some other things and see if we need to adjust that number at all.
I think that sounds good. The main thing is her response to you was just telling you these are the pots of money we're tapping for to cover the costs in the Excel spreadsheet, which is great. It's just that we have this, we can't reimburse costs covered by a public source. So she needs to be able to identify for you every source of public support associated with each of the items on the Excel spreadsheet that they sent. And those need to be backed out because they're not allowed.
Thank you. I'm writing that down. That's helpful. I might have to reach out to you again, Dr. Walker, for
Sure.
some more.
And then they would know what their base salary for their other nurses are. Maybe they could back that out. That's what Ascension did.
Mm-hmm.
Yeah, I think that's how Ascension handled it. I think Lindsay's right.
When does the county commission meet next?
The next special meeting would be Thursday
This week. Okay.
this week, yeah.
And the special meeting, how does it differ from the regular VLCC meeting on Wednesdays? Oh, because of the holiday, maybe?
Right.
Okay, okay,
They won't meet on Wednesday because of Veterans Day.
okay.
So they've got time slated for a special meeting on Thursday.
Well, do you think we could meet Wednesday morning? I mean, there's so many unanswered questions, and my guess is there may be with Ascension too.
Jane, the BOCC chambers are not going to be available that day.
What does that mean?
Wednesday's a holiday for the county,
Oh,
so the building is closed.
That's why there's no meeting Wednesday.
I didn't what holiday is it?
Veterans Day.
Oh, that's a Wednesday holiday. Okay.
So let's talk hypotheticals here. How much we're coming down here to the wire for people to spend this money? How much do we have waiting in the wings besides this? Anything?
We have heard that Wesley is likely to put in a request.
Oh,
Okay.
But Brent, we could, if everyone liked the idea of this, we could approve today up to the 650,000. But when I come back with a revised spreadsheet, could we revise that number and take it down, or would we have to wait until we got the actual number? Because Wesley won't be able to get their application in before our next BOCC meeting, will they?
I don't know how they would, unless this group reconvened Thursday morning or something.
I'm good with the up to $650,000 idea, with the caveat that they have to identify public insurance and back that out of these costs.
And
I agree with that. I agree with that strategy, Dr. Walker. I think they need to account for those costs somewhere, and they're going to have to submit all that for review to the county through that process.
Brent, is that okay if I try to set up a meeting today to kind of walk through and get some numbers? And then if we approve up to 650, can we change it once we get an actual number from them, or how does that work?
If this group would approve up to 650, and they would come back in and revise it down to 500, let's say, I could take 500 to the commission. And this is,
but do we have time to do that, to bring it down?
well, you're going up to 650. If they came in at 500, I could just bring 500 to the commission. Because 500 is somewhere up to 650. Now, if you wanted to leave it at 650, we could make a revision at our next meeting down to whatever number they come up with. But that just gives them the chance to continue to move, because time is of the essence on everybody.
They do have, I mean, we could also just approve the actual, which is not those top ones, but a lot of these are actual reimbursement and things they've already purchased. Would that be cleaner?
I just hate to make them wait another week
Yeah.
to begin to move on hiring, because that seems to be the biggest problem everybody has is staffing.
Actually, I would be willing to support the recommendation that Dr. Walker has placed. If you would repeat that, Dr. Walker, I'd be willing to second that. I think it's up to, or whoever, maybe it was Lynn, not Lynn.
I think Brent and I are saying the same thing. I move that we approve a recommendation of an allocation to the VOCC of up to $650,000 for Rock Regional Hospital. With the caveat that Hope will go back to ROC and ask them to back out the prospective payment and any Medicaid or Medicare reimbursed costs associated with the nursing staff, supplies, et cetera. The EMS
Second.
reimbursement.
Seconded.
Well, we have a motion and a second to approve up to $650,000 for Rock Regional Hospitals with the caveat that Dr. Walker mentioned. All in favor, signify by saying aye.
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 Opposition, same sign. And that motion passes. Next item then would be the supplemental request that we received from Ascension. $2,689,000. I'll give it to Hope to visit about that for a minute.
Okay, sure. Make sure I'm unmuted. Yep. Okay. So the again, like Brent said, the total request from Ascension is $2,869,019. This came up because of the at last meeting we talked about the original $1.9 million that they had requested as under the heading of work from home. So now they're able to actually get some actual costs since, you know, it's already the beginning of November. So they sent us this outline here of how they got to the 2.8 million. They talked about door screeners, interfaces for instruments, the purchases of some equipment, some air purification systems, filter replacements, and some temporary walls that they had to put up. So they did put the cost beside each, and then if it was reoccurring or a one-time cost. So basically that was their ask for equipment related to COVID. I don't know if you guys had a chance to read some of the other information they put down below, but that was pretty helpful as well. And based on Jane's question that she had asked me about the bed space for Rock Regional, I went ahead and did the same with Ascension, just so we could, you know, compare apples to apples. Granted, they are bigger, but they said they currently have over 100 patients in beds right now for COVID. And they said, as for dedicated beds, we have been gradually taking more and more to ensure we have the capacity for the increasing COVID volumes. And by the end of day today, they will have approximately 115 dedicated beds for COVID.
I didn't understand the remdesivir. That's a drug.
Mm-hmm.
Don't they bill for the drug? I didn't understand why they were asking for that.
Yes, they bill for the drug.
So how can it also be reimbursed by the county?
If the patient, so the simple way to think of it is the patient is the payer, and it depends on the payment source the patient is tapping. If the patient is employed, then he or she probably has private insurance. If the patient is employed but working in several part-time jobs, they probably don't have employer-sponsored insurance. They may qualify for Medicaid, or they may be disabled or an older adult and have Medicare. And then Medicare pays for hospitalization, including drugs, nursing, a physician, tongue depressors, you know, the whole 9 yards. And it's that when Medicare pays, or if Medicaid pays, but in this case it's Medicare, these CARES dollars cannot be used to cover those costs. They have to be backed out.
That's what surprised me, why it was in there.
It might be I don't know. Okay, now I don't know. It could be an experimental drug to treat COVID-19. I do not know. But if it is, it wouldn't have been approved yet by CMS for reimbursement.
So they're just providing it free?
know they got to pay for it somehow. Hopefully private insurance companies are paying for it. But I don't know if public insurance, Medicare and Medicaid is paying for it.
They actually must be watching the meeting because I got I got a response right now on that.
Thank you.
Yeah. So the request for that would be for amounts that are not reimbursed by health coverage. Is what essentially they sent me.
But their verbiage says they are also submitting this request for HHS funds. Do we know the status of that? That's a very last paragraph that they wrote.
Yeah. And I'm thinking they'll give us an answer since they're watching. But my question would be, have they actually quantified the number of patients that, do they actually know? Are they extrapolating? How are they quantifying the number of patients that will either have public paid health or private paid health, which would then impact their numbers of the request that they're asking for COVID related dollars?
That's a good question, Melody. So when you bill for reimbursement for services, it's a pretty complicated process, but you have to detail every single service and supply that was used in patient care, and then name the source of revenue associated with it to draw down dollars to get reimbursed.
Right. So they haven't done that yet.
No, but they have a track record of charity care. They're the largest provider of charity care and the largest hospital in the community. Mm-hmm. So there's that. I mean, we know that there's probably going to be some reimbursement that's going to involve public dollars or charity care, which they're essentially writing off, that they've allowed for all of that here. So they're only, I think, since they're watching, maybe they'll weigh in on this, but I think they're only including reimbursement for services that are delivered in the hospital that are covered by private insurance or patients out of their own pocket.
And so they're extrapolating because these aren't actuals.
Right. But they have a whole lot of information, and a lot of people like Hope who work with the billing system. So I'm sure they have a very precise understanding of this, and the estimates are probably pretty accurate. As accurate as they can be, given the transmission rates are through the roof right now.
In reference to the question on the HHS, he said that someone else helped draft that portion of the email, but he said that person is referring to the CARES dollars that the county received from HHS. They have not submitted a request directly to HHS for funding.
Appreciate that clarification. Thank you.
Well, I'm a little nervous about giving this much. I mean, we've already given millions to Ascension. I would like to know what Wesley's going to do before we spend almost all the money.
Brent, do we have any other funds that we would be able to allocate, or is it basically like Jane saying we'd have to choose between the two if we run out?
If we get a request for Wesley that exceeds what's left after, if these two were both approved fully and expended fully, we've already begun looking at the CARES spending plan to see where we might reallocate some dollars. One of the areas is potentially in the testing area. We may not hit the $20 million that we originally allocated there. So we knew we would probably be doing some reallocation. But I think that the thing is that I wouldn't feel constrained by the $18 million limit that we have at this point.
I'm sorry, you wouldn't feel constrained by,
We've got an $18 million bucket. This committee doesn't need to necessarily feel constrained that that's all that we have. Likely do a reallocation. If we see requests from Wesley that exceed the 700,000.
so my question then would be, and honestly, it's an interest also. I understand that we have not received any additional request from community in terms of public health or nonprofit. And it's open until, it's open not indefinitely, but through the near future. So we're going to utilize all of these funds for the larger hospitals, it sounds as though. Larger in the regional, the one regional and then the larger two hospitals. But what if additional requests come from community public health organizations and or nonprofits?
I would say my concern with that is that the deadline, we're counting down in accounting right now, I think in Sedgwick County as a whole, but just we don't have very much time left. A lot of people can't even start spending the money till they get it allocated. So that's just something to consider, that December 30th is coming up really quickly. And November 30th, in terms of having to have the funds encumbered, that's coming up very, very quickly. So I think that's just something to consider as well.
And I agree. I think that that's definitely a determinant. I'm just simply stating, so that it is public, there may be an entity that's able to create or that's able to, substantiate their spendings through that time. And so if we shouldn't feel, how did you say it, Brent? Limited?
Constrained, limited.
Okay, so that would go for any application that we would receive if it meets the requirements and if their data is substantiated and makes sense that they can actually reconcile it by the 30th and spend those dollars by the 30th of November, reconcile, and then spend by the 30th of December. That's all I'm stating.
And we did, I think Aaron had conversations this past week with the public health providers. Some interest on their part in doing something. So we could potentially see some requests this week from them. I want to make sure everybody's aware of that.
All righty, thank you.
And Brent, I just wanted to clarify something that Lindsay nicely pointed out. I just wanted to clarify with the comment earlier about the HHS funding, that the dollars that the county is allocating out is not related to HHS. This is CARES funding. So I just wanted to clarify my statement so I don't cause any confusion.
Any other questions about Ascension or a motion to act on this?
They're withdrawing their other application, is that correct? The one for the 8 million that we basically turned down, and then the work from home too. This is in lieu of.
Right, those have been rejected and they're not up at this point.
Okay.
Brent and Hope, so we're considering from Ascension, the request that we received that totals $2,869,000, $2.869 million.
Correct,
Is that-
that's it.
That's it, okay.
That's
And
the
the bulk of
additional.
that, the bulk of that is drugs, is the pharmaceutical.
Right.
So does anybody know what this drug is?
Oh, yeah, it's been all over the news. It's
It's the COVID drug, right?
the COVID
Right.
drug.
Mm-hmm.
Okay, so I guessed right.
And it has been approved for use in COVID, so that's why I don't understand why they can't bill for it. That's the piece I guess I still don't understand. Or is it more expensive than what they get reimbursed? Is that maybe the difference?
No, you're
Hope,
right.
can you ask?
Yes, I thought I had a response. I was looking that up real quick.
So it's who pays,
Yeah.
not,
Yeah, it was they said it was for the amounts that are not reimbursed by health coverage. So I don't know if there's a better way I can ask that.
okay, so the pharmaceutical company has this drug available to treat COVID-19. The hospital, Ascension Via Christi, uses it to treat patients who are hospitalized. So they're telling you, what about the payment, Hope?
They said it's for the portion that is not reimbursed by health coverage.
Okay, so some private health insurance and maybe even public health insurance will say, we'll pay up to this amount for this drug, but the drug cost to the hospital is actually greater than that. So they're asking for reimbursement of the portion that's not paid by anybody's insurance, public or private. Is that your interpretation, Hope?
Yes.
Okay, well, I would be okay with that.
Okay, so I would like to make a motion that we recommend funding the $2,869,019 application from Ascension Via Christi.
Second.
We have a motion and a second to recommend approval of $2,869,019 to Ascension Via Christi. All in favor, signify by saying aye.
Aye.
Aye. Opposition? That motion passes unanimously. So that the approvals today of up to $3,519,019 for Rock Regional Hospital and Ascension.
Brent, this stuff is,
700,000.
Right.
this is a really good discussion. These requests are complicated, and we're all asking really good questions, trying to come to an understanding of what's being requested and what's allowed. So thumbs up for everybody.
Yes.
We appreciate your expertise, helping us through.
Absolutely.
Absolutely.
Mhm. Yeah, appreciate everyone's expertise. It's not an
Not-
easy process.
It is not just me. I'm just thinking out loud.
Are there anything, anyone have anything else to come before the team this morning?
Aaron did send around the Excel spreadsheet from a few weeks ago that showed the amount requested and the amount allocated. Maybe the next time we meet, we could take a peek at that just to make sure there isn't something there that we would like to return to. Is it possible to get that updated too before our next meeting?
I think we can do that.
Thank you.
Anything else this morning? Not, again, I appreciate everyone's time this morning. We'll take these recommendations to the commission this week, hopefully get approval from them. As we get any additional applications this week, we'll forward them to you as quickly as possible. Keep the ball rolling.
Thank you.
Nothing else, I would look for a motion to adjourn.
So moved.
And second.
Very good. It's been moved and seconded to adjourn. All in favor signify by saying aye.
Hi.
Hi.
Passes unanimously. And we will see you all in another week. Take care.
Okay.
Stay
Bye-bye.
safe, everybody.
Yes, enjoy the rain.
Bye.